Question 1. Quality control measures reveal that a patient received a specialized orthotic brace, not typically included in the standard surgical package for their procedure. The brace was prescribed by the physician for post-operative support. What is the most appropriate action for the coder to take regarding the billing of this orthotic brace? Option A. Omit the code for the orthotic brace as it was prescribed post-operatively. Option B. Identify and assign the most specific HCPCS level Roman II code that accurately describes the orthotic brace. Option C. Assign a CPT code that best reflects the physician's prescription for support. Option D. Assign a generic supply code that broadly covers medical supplies. The correct answer is B. Identify and assign the most specific HCPCS level Roman II code that accurately describes the orthotic brace. Explanation. This scenario is professionally challenging because it requires a coder to accurately identify and apply specific codes for supplies and services that are not typically covered by standard procedure codes. The risk lies in misinterpreting the purpose of a supply or service, leading to incorrect billing and potential compliance issues. Careful judgment is required to differentiate between supplies that are integral to a procedure and those that are separately billable, and to select the most appropriate HCPCS level Roman II code to reflect the unique nature of the item or service. The correct approach represents best professional practice because it prioritizes accurate coding based on the specific nature of the supply or service, aligning with the intent of HCPCS level Roman II codes. These codes are designed to report supplies, materials, injections, drugs, and other services not included in the CPT codes. By correctly identifying the specific HCPCS level Roman II code for a durable medical equipment item, the coder ensures that the claim accurately reflects the service provided, facilitating proper reimbursement and compliance with payer guidelines. This demonstrates a thorough understanding of the coding system's purpose and application. An incorrect approach of assigning a generic supply code fails to capture the specific nature of the item. HCPCS level Roman II codes are hierarchical and specific. Using a generic code when a specific one exists is a violation of coding guidelines and payer policies, which often require the most specific code available. This can lead to underpayment or overpayment, and may be considered fraudulent or abusive billing. Another incorrect approach of omitting the code entirely for a separately billable item is a direct violation of billing regulations. If an item or service is intended to be billed separately and has a designated HCPCS level Roman II code, its omission means the service is not being fully or accurately reported. This can result in lost revenue for the provider and may be viewed as an attempt to conceal services or avoid scrutiny, leading to significant compliance penalties. The professional reasoning process for similar situations should involve a systematic approach. First, determine if the supply or service is separately billable from the primary procedure. If it is, consult the HCPCS level Roman II code set. Search for the most specific code that accurately describes the item or service. If ambiguity exists, refer to payer guidelines, manufacturer information, and coding resources. Document the rationale for code selection, especially in complex cases, to support the billing decision and ensure audit readiness. This methodical process minimizes the risk of errors and upholds coding integrity. Question 2. Assessment of a patient's diagnosis of a malignant neoplasm requires careful consideration of how this sensitive information is documented and shared within the healthcare team. A physician has just confirmed a diagnosis of a lung carcinoma in a patient. The patient has expressed a desire for privacy regarding their condition. The physician needs to document this diagnosis in the patient's electronic health record and also inform the patient's primary care physician, who is involved in their ongoing management. What is the most ethically and regulatorily sound approach for the physician to take? Option A. Obtain explicit, written consent from the patient to disclose the diagnosis to their primary care physician, and ensure the diagnosis is accurately and fully documented in the electronic health record. Option B. Omit the specific diagnosis of neoplasm from the electronic health record to protect the patient's privacy and only document general findings. Option C. Document the diagnosis in the electronic health record and inform the primary care physician, believing that the patient's condition necessitates immediate disclosure without explicit consent. Option D. Document the diagnosis in the electronic health record and inform the primary care physician verbally, assuming the patient's consent due to their involvement in care. The correct answer is A. Obtain explicit, written consent from the patient to disclose the diagnosis to their primary care physician, and ensure the diagnosis is accurately and fully documented in the electronic health record. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's right to privacy and the need for accurate medical record keeping, particularly when dealing with sensitive diagnoses like neoplasms. The healthcare professional must navigate the ethical imperative of patient confidentiality with the regulatory requirements for clear and complete documentation. The correct approach represents best professional practice because it prioritizes obtaining explicit, informed consent from the patient before disclosing any information, even to other healthcare providers involved in their care. This aligns with fundamental ethical principles of autonomy and respect for persons, as well as regulatory frameworks that mandate patient consent for the release of protected health information. By seeking consent, the professional upholds the patient's control over their personal medical data and avoids potential breaches of privacy. An incorrect approach that involves disclosing the diagnosis without explicit consent, even if to a treating physician, represents a failure to adhere to privacy regulations. Such an action could lead to legal repercussions and erode patient trust. Another incorrect approach, such as omitting the diagnosis from the record entirely, compromises the integrity of the medical record and could negatively impact future patient care by withholding crucial diagnostic information from other clinicians. A third incorrect approach, which involves making assumptions about the patient's willingness to share information based on their condition, violates the principle of informed consent and can lead to unintended disclosures. Professional decision-making in such situations requires a systematic approach. First, identify the ethical and regulatory obligations. Second, assess the potential risks and benefits of each course of action. Third, consult relevant policies and guidelines. And finally, prioritize patient autonomy and confidentiality while ensuring accurate and complete medical documentation. Question 3. Comparative studies suggest that the interpretation of medical documentation for accurate ICD coding can be complex. A coder reviews a patient's chart and notes a diagnosis of chest pain. However, the physician's progress notes also mention rule out myocardial infarction and possible pneumonia. Based on best practices in medical coding, which of the following actions best reflects the coder's responsibility? Option A. Sign a code for myocardial infarction based on the physician's concern for this serious condition. Option B. Query the physician to clarify the definitive diagnosis and obtain more specific documentation before assigning codes. Option C. Assign a code for chest pain as it is the most definitive stated diagnosis. Option D. Assign codes for chest pain, rule out myocardial infarction, and possible pneumonia to capture all mentioned conditions. The correct answer is C. Assign a code for chest pain as it is the most definitive stated diagnosis. Explanation. This scenario is professionally challenging because it requires a coder to balance the need for accurate and complete documentation with the potential for misinterpretation or overcoding that could lead to improper billing. The core of medical coding, particularly within the context of ICD, International Classification of Diseases, as implied by the exam preparation, is to reflect the patient's condition and services rendered as precisely as possible, adhering strictly to established coding guidelines. The correct approach represents best professional practice because it prioritizes a thorough review of the medical record and consultation with the physician when documentation is ambiguous or incomplete. This ensures that the codes assigned accurately reflect the patient's diagnosis and the services provided, aligning with the principles of ethical coding and regulatory compliance. It upholds the integrity of the medical record and supports appropriate reimbursement without resorting to assumptions or speculative coding. This aligns with the fundamental principle of coding to the highest level of specificity supported by documentation. An incorrect approach that involves coding based on assumptions or prior knowledge of similar cases without explicit documentation is a significant regulatory and ethical failure. It violates the principle that codes must be supported by the medical record. This can lead to inaccurate data, potentially impacting public health statistics, research, and quality reporting. Furthermore, it can result in fraudulent billing practices, which carry severe legal and financial penalties. Another incorrect approach, such as coding only the most obvious or easily identifiable diagnosis, fails to capture the full clinical picture and can lead to underreporting of patient complexity, impacting reimbursement and potentially hindering accurate quality assessment. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly review all available documentation. Second, identify any ambiguities, inconsistencies, or missing information. Third, consult the relevant coding guidelines and official coding advice for clarification. Fourth, if clarification is still needed, query the physician for more specific documentation. Finally, assign codes only when they are fully supported by the documented evidence, ensuring accuracy, completeness, and compliance. Question 4. Risk assessment procedures indicate a potential for upcoding to increase reimbursement. A coder is asked by their supervisor to assign ICD codes that are not fully supported by the physician's documentation, with the supervisor stating it is a common practice to maximize revenue. The coder believes this request is unethical and inaccurate. What is the most appropriate course of action for the coder? Option A. Ignore the supervisor's suggestion and proceed with coding based solely on personal interpretation of the documentation, without addressing the discrepancy. Option B. Comply with the supervisor's request to assign the codes that maximize revenue, assuming the supervisor has a better understanding of the organization's financial goals. Option C. Politely refuse the request, explaining that the proposed codes do not accurately reflect the documented services and that accurate coding is essential for ethical and compliant practice. Option D. Immediately escalate the issue to external regulatory bodies without attempting to discuss the concern with the supervisor. The correct answer is C. Politely refuse the request, explaining that the proposed codes do not accurately reflect the documented services and that accurate coding is essential for ethical and compliant practice. Explanation. Scenario analysis. This scenario is professionally challenging because it presents a conflict between a coder's duty to accurately represent patient care and the pressure to satisfy a supervisor's potentially unethical request. Coder must navigate the potential for professional repercussions, e.g., disciplinary action, job loss if they refuse, while upholding their ethical obligations to the patient, the healthcare system, and the integrity of medical records. The ICD International Classification of Diseases coding system relies on accurate documentation for its effectiveness in data analysis, research, and reimbursement, making any deviation from truthfulness a serious ethical breach. Correct approach analysis. The correct approach involves politely but firmly refusing the supervisor's request and explaining that the proposed coding does not accurately reflect the documented services. This upholds the coder's ethical responsibility to ensure that codes assigned are supported by the medical record, as per professional coding guidelines and ethical codes, e.g., AHIMA Code of Ethics. Accurate coding is fundamental to the integrity of healthcare data, influencing patient care decisions, public health reporting, and fair reimbursement. By refusing, the coder prioritizes professional integrity and compliance with coding standards over expediency or pressure. Incorrect approaches analysis. One incorrect approach involves complying with the supervisor's request to assign codes that are not supported by the documentation. This is a direct violation of ethical coding principles and potentially fraudulent. It misrepresents the services provided, which can lead to incorrect statistical data, inappropriate resource allocation, and unfair financial gain or loss for the healthcare provider. This action undermines the trust placed in medical coders and the accuracy of the ICD system. Another incorrect approach is to ignore the discrepancy and proceed with coding as if the supervisor's suggestion were valid without further investigation or clarification. This demonstrates a lack of professional diligence and an abdication of responsibility. It fails to address the ethical concern directly and allows a potentially inaccurate record to be created, which can have downstream consequences for patient care and billing. A third incorrect approach is to immediately report the supervisor to external regulatory bodies without first attempting to resolve the issue internally through professional dialogue. While reporting is an option if internal resolution fails, bypassing direct communication and explanation can escalate the situation unnecessarily and may not be the most constructive first step in a professional environment, provided the initial refusal is clear and documented. Professional reasoning. Professionals facing such a dilemma should first ensure they have thoroughly reviewed the medical documentation to confirm the discrepancy. They should then communicate their findings and concerns clearly and respectfully to their supervisor, referencing coding guidelines and ethical principles. If the supervisor insists on the unethical coding, the coder should document their refusal and the reasons for it. If the situation persists or escalates, the coder should consult their organization's compliance officer or ethics committee, or seek guidance from professional coding organizations. This structured approach prioritizes ethical conduct, professional integrity, and adherence to regulatory frameworks. Question 5. To address the challenge of a patient presenting with symptoms suggestive of a severe mental disorder that may impair their judgment and decision-making capacity, what is the most appropriate initial course of action for a healthcare professional? Option A. Initiate a comprehensive, multidisciplinary assessment to evaluate the patient's mental state, cognitive functioning, and capacity to make informed decisions about their care, exploring all available treatment options and less restrictive alternatives. Option B. Immediately implement a prescribed treatment plan based on the initial presentation, assuming the disorder significantly impairs the patient's ability to consent. Option C. Rely solely on the initial assessment by the referring physician without further independent evaluation of the patient's current capacity. Option D. Proceed with the most intensive level of care available to ensure patient safety, without first conducting a detailed assessment of their specific needs and preferences. The correct answer is A. Initiate a comprehensive, multidisciplinary assessment to evaluate the patient's mental state, cognitive functioning, and capacity to make informed decisions about their care, exploring all available treatment options and less restrictive alternatives. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of diagnosing and managing mental disorders, particularly when they intersect with an individual's capacity to make informed decisions about their care. The professional must balance the duty of care with the individual's autonomy, while also adhering to strict regulatory frameworks governing mental health services and patient rights. Misjudgments can lead to significant harm, including inappropriate treatment, loss of liberty, or failure to provide necessary support. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a comprehensive, multidisciplinary assessment. This involves gathering information from various sources, including the individual, their family or support network, with consent where appropriate, and other healthcare professionals. It emphasizes understanding the specific nature of the mental disorder, its impact on the individual's cognitive functioning and decision-making capacity, and exploring less restrictive alternatives before considering involuntary measures. This aligns with regulatory requirements that mandate thorough assessments, consideration of least restrictive options, and respect for patient rights, ensuring that any intervention is justified, proportionate, and in the individual's best interests, while adhering to principles of beneficence and non-maleficence. Correct approaches analysis. An approach that immediately proceeds with a specific treatment plan without a thorough assessment of the individual's current mental state and capacity fails to meet regulatory standards for patient assessment and informed consent. It risks imposing treatment that may be inappropriate or unnecessary, violating the principle of beneficence and potentially causing harm. An approach that solely relies on the opinion of one professional, without seeking input from other disciplines or considering the individual's perspective, is likely to be incomplete and biased. Regulatory frameworks often require multidisciplinary input for significant decisions regarding mental health care, especially concerning capacity and involuntary treatment. This failure to consult can lead to misdiagnosis or an incomplete understanding of the individual's needs and rights. An approach that prioritizes the convenience of the service provider over the individual's well-being and rights is ethically and regulatorily unacceptable. Decisions regarding mental health care must be driven by the individual's needs and best interests, not by administrative ease. This could involve overlooking less restrictive options or failing to involve the individual in decision-making processes, thereby violating their autonomy and potentially leading to a breach of duty of care. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough, multidisciplinary assessment of the individual's mental state, functional capacity, and specific needs. This assessment should inform the development of a care plan that is tailored to the individual, prioritizing their autonomy and least restrictive options. Throughout the process, professionals must maintain clear communication with the individual and their support network, where appropriate, ensuring transparency and adherence to all relevant legal and ethical guidelines. Regular review and reassessment are crucial to adapt the care plan as the individual's condition evolves. Question 6. The risk matrix shows a moderate likelihood of coding errors due to ambiguous provider documentation regarding a patient's diagnosis. The coder has reviewed the encounter notes and identified that the provider documented respiratory distress, but did not specify the underlying cause or severity. The coder is unsure whether to assign a general code for respiratory distress or to query the provider for more specific information. Which of the following represents the best professional practice in this scenario? Option A. Assign the most general code for respiratory distress, as the provider's documentation is sufficient for a basic understanding. Option B. Query the provider for clarification on the specific cause and severity of the respiratory distress to ensure accurate coding. Option C. Assign a more specific code for respiratory distress based on the coder's clinical interpretation of the patient's symptoms described in the notes. Option D. Document the ambiguity in the coding notes and proceed with the most general code available without further action. The correct answer is B. Query the provider for clarification on the specific cause and severity of the respiratory distress to ensure accurate coding. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, where a provider's documentation is ambiguous regarding the specificity of a diagnosis. The professional challenge lies in balancing the need for accurate and complete coding for proper reimbursement and statistical tracking, with the ethical obligation to code only what is documented. Misinterpreting or extrapolating from vague documentation can lead to significant compliance issues. Careful judgment is required to determine the most appropriate coding action based on the available information and established coding guidelines. Correct approach analysis. The correct approach involves seeking clarification from the provider. This aligns with best professional practice and regulatory expectations. The ICD International Classification of Diseases coding guidelines, which are fundamental to accurate medical coding in the U.S. healthcare system, emphasize that coders should not make assumptions or interpret documentation beyond what is explicitly stated. When documentation is unclear or lacks specificity, the coder's responsibility is to query the provider for more precise information. This ensures that the code assigned accurately reflects the patient's condition, which is crucial for appropriate reimbursement, quality reporting, and public health data. This practice upholds the integrity of the medical record and coding system. Incorrect approaches analysis. Assigning a more specific code based on the coder's assumption of the provider's intent is a direct violation of coding ethics and regulations. This practice can lead to upcoding, which is fraudulent and results in improper reimbursement. It misrepresents the patient's condition in the medical record and statistical data. Assigning a less specific code without attempting to gain clarity from the provider is also problematic. While it avoids overcoding, it fails to capture the full clinical picture documented by the provider, potentially impacting quality metrics, research, and appropriate resource allocation. It does not represent best practice as it bypasses the opportunity to achieve accurate coding through provider collaboration. Ignoring the ambiguity and proceeding with the most general code that fits the limited information, without any attempt at clarification, demonstrates a lack of diligence. This approach fails to meet the standard of accurately reflecting the documented condition and can lead to underreporting of services or conditions, impacting various downstream processes that rely on precise coding. Professional reasoning. Professionals in this situation should follow a structured decision-making process. First, thoroughly review the provider's documentation to identify any ambiguity or lack of specificity. Second, consult the relevant coding guidelines, e.g., ICD 10cm official guidelines for coding and reporting, to understand the rules pertaining to the suspected condition. Third, if ambiguity persists, initiate a provider query. This query should be clear, concise, and specific, asking the provider to clarify the diagnosis or condition. Fourth, once clarification is received, assign the most accurate and specific code based on the updated documentation. This systematic approach ensures compliance, accuracy, and ethical practice. Question 7. The control framework reveals a patient admitted to the hospital with a documented history of chronic obstructive pulmonary disease, COPD. During the hospital stay, the patient develops pneumonia. The physician's documentation indicates that the COPD exacerbation was the primary reason for admission, leading to increased respiratory distress, and that the pneumonia developed as a complication of this compromised respiratory state. The physician also documented treatment for both conditions. Based on this information and the ICD 10-CM official guidelines for coding and reporting, how should the diagnosis be sequenced? Option A. The order of sequencing should be based on the order in which the diagnoses were first documented in the medical record. Option B. Both diagnoses should be sequenced as secondary diagnoses, with no principal diagnosis identified. Option C. The COPD exacerbation should be sequenced as the principal diagnosis, followed by pneumonia as a secondary diagnosis. Option D. Pneumonia should be sequenced as the principal diagnosis, followed by the COPD exacerbation as a secondary diagnosis. The correct answer is C. The COPD exacerbation should be sequenced as the principal diagnosis, followed by pneumonia as a secondary diagnosis. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the coder to navigate the complexities of ICD 10-CM coding guidelines, specifically concerning the sequencing of diagnoses when a patient presents with multiple conditions. The challenge lies in accurately identifying the principal diagnosis, which dictates the primary reason for the encounter, and then correctly sequencing secondary diagnoses to reflect the full clinical picture and support medical necessity. Misinterpretation can lead to inaccurate billing, improper reimbursement, and potentially flawed quality reporting. Correct approach analysis. The correct approach involves a thorough review of the medical record to identify all documented diagnoses. The coder must then apply the ICD 10-CM official guidelines for coding and reporting, paying close attention to the definitions of principal diagnosis and secondary diagnosis. The guideline for selection of principal diagnosis states it is the condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital for care. In this case, the patient's acute exacerbation of COPD, which necessitated the admission and required significant intervention, is the condition chiefly responsible. The subsequent development of pneumonia is a complication or manifestation of the underlying respiratory distress, making it a secondary diagnosis. This approach ensures compliance with coding standards, accurate representation of patient care, and appropriate reimbursement. Incorrect approaches analysis. One incorrect approach would be to assign the pneumonia as the principal diagnosis simply because it was documented later in the hospital stay or because it required specific treatment. This fails to adhere to the guideline that the principal diagnosis is the condition chiefly responsible for the admission. The pneumonia, in this context, is a consequence of the patient's compromised respiratory state due to the COPD exacerbation. Another incorrect approach would be to code only the COPD exacerbation and not the pneumonia. This would fail to capture the full scope of the patient's illness and the services provided, potentially leading to underreporting of the complexity of care. A third incorrect approach would be to arbitrarily sequence the diagnoses without a clear understanding of the causal relationship or the guidelines for principal diagnosis selection. This demonstrates a lack of diligence and adherence to established coding principles, risking inaccurate data and compliance issues. Professional reasoning. Professionals should approach such scenarios by first understanding the patient's chief complaint and the reason for admission as documented by the physician. They must then consult the ICD 10-CM official guidelines for coding and reporting, specifically the sections on selection of principal diagnosis and sequencing of diagnoses. A systematic review of the medical record, including physician notes, diagnostic test results, and treatment plans, is crucial. When in doubt, querying the physician for clarification on the primary reason for admission and the relationship between documented conditions is a vital step in ensuring accurate coding. This methodical process, grounded in regulatory guidelines and clinical documentation, forms the basis of professional decision-making. Question 8. Process analysis reveals that a healthcare facility is experiencing challenges in consistently assigning accurate ICD codes for complex patient encounters. A review of coding practices indicates that some coders are relying on their prior knowledge of common diagnoses without always cross-referencing the specific clinical documentation for each patient. Other coders are prioritizing the speed of coding to meet productivity targets, sometimes leading to the selection of codes that may not fully capture the nuances of the patient's condition. A third group of coders is attempting to infer the most likely diagnosis based on the overall clinical picture, even when certain elements are not explicitly documented. Which of the following approaches best aligns with the principles of accurate ICD coding and regulatory compliance? Option A. Inferring diagnoses based on the overall clinical presentation and common disease trajectories, even if specific documentation is lacking for certain aspects of the patient's condition. Option B. Thoroughly reviewing all available clinical documentation for each patient encounter and assigning ICD codes that accurately reflect the documented diagnoses and procedures, seeking clarification from healthcare providers when documentation is unclear or incomplete. Option C. Prioritizing coding speed by utilizing generalized codes for common conditions and relying on established patterns of care to expedite the coding process. Option D. Coding based on the coder's prior experience and knowledge of frequently encountered diagnoses, without the necessity of detailed review of every piece of documentation for each encounter. The correct answer is B. Thoroughly reviewing all available clinical documentation for each patient encounter and assigning ICD codes that accurately reflect the documented diagnoses and procedures, seeking clarification from healthcare providers when documentation is unclear or incomplete. Explanation. This scenario presents a professional challenge because the implementation of the ICD coding system requires a nuanced understanding of both the coding guidelines and the specific clinical documentation provided. The challenge lies in accurately translating complex medical information into standardized codes, ensuring that the codes reflect the patient's condition, services rendered, and all relevant factors, without introducing bias or misinterpretation. Careful judgment is required to navigate potential ambiguities in documentation and to select the most appropriate codes according to the ICD coding system's hierarchical structure and specific rules. The correct approach represents best professional practice because it prioritizes adherence to the official ICD coding guidelines and the principle of coding based on documented evidence. This ensures the accuracy, consistency, and comparability of health data, which is crucial for reimbursement, statistical analysis, public health reporting, and quality improvement initiatives. By meticulously reviewing the documentation and applying the ICD coding system as intended, professionals uphold the integrity of the coding process and contribute to reliable healthcare information. An incorrect approach that involves coding based on assumptions or incomplete documentation fails to meet professional standards. This can lead to inaccurate code assignment, which has significant ethical and regulatory implications. Specifically, it can result in improper billing and reimbursement, potentially violating regulations related to healthcare fraud and abuse. Furthermore, it compromises the integrity of health data, leading to flawed statistical analysis and hindering effective public health monitoring and research. Coding based on assumptions also demonstrates a lack of diligence and a failure to uphold the professional responsibility to accurately represent patient care. Another incorrect approach, such as prioritizing speed over accuracy by using shortcuts or generalized coding practices, also constitutes a regulatory and ethical failure. While efficiency is desirable, it must not come at the expense of accurate code assignment. This approach can lead to misdiagnoses, undercoding, or overcoding, all of which have negative consequences for patient care, financial reporting, and regulatory compliance. It reflects a disregard for the detailed requirements of the ICD coding system and the importance of precise medical record abstraction. The professional reasoning process for similar situations should involve a systematic review of the patient's medical record, paying close attention to physician documentation, diagnostic reports, and treatment plans. Professionals must be thoroughly familiar with the ICD coding guidelines, including any updates or specific instructions relevant to the encounter. When faced with ambiguity, the professional decision-making process dictates seeking clarification from the healthcare provider or consulting official coding resources and experts. The ultimate goal is to assign codes that accurately and completely reflect the patient's condition and the services provided, in strict accordance with the established coding framework. Question 9. Consider a scenario where a patient presents to the emergency department with a fractured wrist sustained during a fall. The physician's documentation states, "Patient reports falling while walking at home." The coder is unsure if "at home" is sufficient detail to assign a specific external cause code for the fall, as ICD guidelines suggest more specificity regarding the activity or environment of the fall if available. The coder has reviewed the physician's notes and found no further details about the circumstances of the fall within the home. What is the most appropriate course of action for the coder in this situation? Option A. Assign a general external cause code for fall on same level from slipping, tripping, and stumbling without subsequent striking against object, as the patient was at home. Option B. Omit the external cause code entirely due to insufficient documentation. Option C. Assign an external cause code for fall on same level from slipping, tripping, and stumbling without subsequent striking against object, and add a modifier indicating uncertainty. Option D. Query the physician to obtain more specific details about the circumstances of the fall at home. The correct answer is D. Query the physician to obtain more specific details about the circumstances of the fall at home. Explanation. This scenario presents a professional challenge because the coder is faced with conflicting information and the potential for misrepresentation of patient care. The primary ethical and regulatory imperative in medical coding is accuracy and adherence to established coding guidelines. Misrepresenting the cause of injury can have significant implications for patient care, statistical reporting, and reimbursement. The correct approach involves diligently seeking clarification from the physician to ensure the external cause code accurately reflects the documented circumstances of the injury. This upholds the principle of truthful and accurate representation of patient encounters, which is fundamental to ethical coding practice and compliance with regulatory frameworks like the ICD coding system. By obtaining physician clarification, the coder ensures the external cause code is supported by the medical record and aligns with the physician's clinical documentation, preventing potential downstream errors in data analysis and patient management. An incorrect approach would be to assign an external cause code based on assumptions or incomplete information. This failure to seek clarification directly violates the principle of accurate coding. It can lead to misclassification of injury causes, impacting public health data, research, and the identification of injury prevention strategies. Furthermore, it could result in inaccurate billing and reimbursement, potentially violating payer policies and federal regulations concerning fraudulent or abusive billing practices. Assigning a code without sufficient documentation or physician confirmation is a breach of professional responsibility and can be considered a form of misrepresentation. Another incorrect approach would be to omit the external cause code entirely because the documentation is unclear. While the intent might be to avoid miscoding, this also fails to capture important information about the circumstances of the injury. External cause codes are crucial for understanding injury patterns and developing prevention programs. Omitting them, when an injury has occurred, deprives health systems and public health agencies of valuable data. This inaction, when a code is warranted but documentation is ambiguous, represents a failure to fully utilize the ICD coding system for its intended purpose of comprehensive injury surveillance. The professional decision-making process in such situations should involve a systematic approach. 1. Identify the ambiguity or missing information in the medical record regarding the external cause of injury. 2. Consult the ICD coding guidelines for external causes of injury to understand the appropriate coding principles and available codes. 3. If documentation is insufficient to assign an accurate code, query the physician for clarification. The query should be specific, referencing the suspected external cause and requesting confirmation or correction. 4. Document the query and the physician's response thoroughly in the patient's record. 5. Assign the external cause code based on the clarified documentation. 6. If the physician cannot provide clarification or confirms the information is not documented, the coder must then decide whether an external cause code can be assigned based on the available, albeit limited, information, or if it must be omitted with clear documentation of the rationale. The priority remains accurate representation of documented facts. Question 10. The investigation demonstrates that a medical coder is tasked with identifying the correct CPT code for a diagnostic imaging procedure. The coder must determine which of the following best reflects the hierarchical structure of the CPT code set for this type of service. Option A. The procedure is found in the surgery section, under a subcategory for diagnostic procedures, and then by the physician's specialty. Option B. The procedure falls within the radiology section, specifically under diagnostic imaging, and is further categorized by the type of imaging modality used. Option C. The procedure is located within the medicine section, under a general category for diagnostic tests, and then by the anatomical site. Option D. The procedure is classified under the pathology and laboratory section, within a category for imaging analysis, and then by the specific laboratory test performed. Correct answer is B. The procedure falls within the radiology section, specifically under diagnostic imaging, and is further categorized by the type of imaging modality used. Explanation. This scenario is professionally challenging because accurately categorizing and understanding the structure of CPT codes is fundamental to correct medical billing and reimbursement. Misinterpreting the categories or sections can lead to significant financial discrepancies, compliance issues, and potential audits. The professional must possess a thorough understanding of the CPT manual's organizational principles to ensure accurate code selection. The correct approach represents best professional practice because it demonstrates a systematic and accurate application of the CPT code structure. By correctly identifying the category and section, the professional ensures that the chosen code aligns with the described service or procedure according to the established guidelines within the CPT manual. This adherence to the manual's structure is a core regulatory requirement for accurate coding and billing, preventing fraud, waste, and abuse. An incorrect approach that misidentifies the category or section fails to adhere to the fundamental organizational principles of the CPT code set. This can lead to the selection of an inappropriate code, which is a direct violation of billing regulations and could be considered a misrepresentation of services rendered. Such errors can result in claim denials, recoupments, and penalties under healthcare fraud and abuse laws. Another incorrect approach might involve relying on external, unverified resources instead of the official CPT manual, which bypasses the established regulatory framework for code usage and introduces a high risk of noncompliance. The professional decision-making process for similar situations should involve 1. Thoroughly reviewing the patient's medical record to understand the service or procedure performed. 2. Consulting the most current version of the CPT manual. 3. Identifying the appropriate section, e.g., surgery, medicine, radiology, based on the nature of the service. 4. Within that section, determining the correct category, e.g., specific body system or type of procedure. 5. Selecting the most specific and accurate CPT code that describes the service, paying close attention to any included or excluded services and any necessary modifiers. 6. If ambiguity exists, consulting official CPT coding guidelines, payer policies, or seeking clarification from a certified coding professional or compliance officer. Question 11. Upon reviewing a patient's encounter notes, which includes a physician's assessment of multiple chronic conditions and a new acute diagnosis, what is the most appropriate risk assessment approach to ensure accurate ICD-10-CM code assignment? Option A. Utilize external medical knowledge to infer potential diagnoses not explicitly documented in the patient's record. Option B. Assign codes based primarily on the chief complaint listed at the beginning of the encounter notes. Option C. Select the first ICD-10-CM code that appears to be a reasonable match for the patient's symptoms to expedite the coding process. Option D. Systematically analyze all documented conditions, including chronic and acute diagnoses, and select the most specific ICD-10-CM codes supported by the clinical documentation. The correct answer is D. Systematically analyze all documented conditions, including chronic and acute diagnoses, and select the most specific ICD-10-CM codes supported by the clinical documentation. Explanation. This scenario presents a professional challenge because accurately identifying and coding ICD-10-CM codes is fundamental to proper medical record documentation, billing, and ultimately, patient care reimbursement. The complexity arises from the need to interpret clinical documentation, understand the nuances of ICD-10-CM coding guidelines, and apply them correctly to a specific patient encounter. A risk assessment approach is crucial to ensure that the coding reflects the patient's condition accurately and completely, thereby avoiding potential issues with audits, claim denials, and compliance violations. The correct approach involves a thorough review of the entire medical record, including physician's notes, diagnostic test results, and any other relevant documentation, to identify all conditions that were treated, evaluated, or managed during the encounter. This comprehensive understanding allows for the selection of the most specific and appropriate ICD 10cm codes. This represents best professional practice because it directly aligns with the ICD 10cm official guidelines for coding and reporting, which mandate coding to the highest level of specificity. Adhering to these guidelines ensures accurate data for public health statistics, research, and financial reimbursement, while also demonstrating due diligence and compliance with regulatory requirements. An incorrect approach that focuses solely on the chief complaint, without considering other documented conditions, is professionally unacceptable. This failure violates the principle of coding all conditions that affect patient care, as outlined in the ICD 10cm guidelines. Such an approach can lead to undercoding, which may result in insufficient reimbursement and an incomplete picture of the patient's health status. Another incorrect approach that relies on assumptions or external information not present in the medical record is also professionally unacceptable. This practice introduces a high risk of inaccurate coding and potential fraud or abuse. The ICD 10cm guidelines emphasize that coders must base their selections on documented evidence within the patient's chart. A third incorrect approach that prioritizes speed over accuracy by selecting the first plausible code encountered is detrimental. This haste can lead to the omission of more specific codes or the selection of incorrect codes, both of which have significant negative consequences for billing accuracy and compliance. The professional decision-making process for similar situations should involve a systematic review of the medical record, a clear understanding of the ICD 10cm coding guidelines, and a commitment to querying the physician for clarification when documentation is ambiguous or incomplete. This methodical approach minimizes the risk of errors and ensures the integrity of the coding process. Question 12. Stakeholder feedback indicates that clients experiencing persistent joint pain and stiffness are increasingly seeking advice from professionals regarding potential musculoskeletal disorders. A client presents with these symptoms, describing limitations in their daily activities and expressing concern about the cause. The professional is trained in general wellness and client support, but is not a medical doctor. What is the most appropriate course of action for the professional in this situation? Option A. Provide the client with a list of common musculoskeletal disorders and suggest they research potential causes and treatments online. Option B. Advise the client on specific exercises and stretches that might alleviate their pain based on general knowledge of physical activity. Option C. Acknowledge the client's symptoms, offer empathetic support, and strongly recommend they consult a qualified medical practitioner for a proper diagnosis and treatment plan. Option D. Reassure the client that such symptoms are common and often resolve on their own with rest, without the need for further medical intervention. The correct answer is C. Acknowledge the client's symptoms, offer empathetic support, and strongly recommend they consult a qualified medical practitioner for a proper diagnosis and treatment plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate needs of a client experiencing a musculoskeletal disorder with the regulatory obligations of providing accurate and appropriate advice. The complexity arises from the need to understand the limitations of the professional's role, particularly in diagnosing medical conditions, and the potential for misinterpretation or overstepping boundaries, which could lead to harm or regulatory breaches. Correct approach analysis. The correct approach demonstrates best professional practice by acknowledging the client's symptoms, offering support within the scope of the professional's expertise, and crucially, directing the client to seek appropriate medical evaluation. This aligns with regulatory frameworks that mandate professionals to operate within their competence and to refer clients to qualified medical practitioners for diagnosis and treatment of health conditions. It upholds ethical principles of client welfare and professional integrity by avoiding the unauthorized practice of medicine and ensuring the client receives the necessary specialized care. Incorrect approaches analysis. One incorrect approach involves attempting to provide a diagnosis or specific treatment recommendations for the musculoskeletal disorder. This constitutes the unauthorized practice of medicine, a serious regulatory and ethical failure. Professionals are not licensed medical practitioners, and offering such advice can lead to incorrect self-treatment, delayed proper medical care, and potential harm to the client. It violates the principle of operating within one's scope of practice. Another incorrect approach is to dismiss the client's concerns or provide generic, unhelpful advice without suggesting further action. This fails to meet the professional duty of care. While not directly practicing medicine, it neglects the responsibility to guide the client towards appropriate resources, potentially leaving them without necessary support and exacerbating their condition. This can be seen as a failure in professional diligence and client advocacy. A third incorrect approach might involve recommending specific over-the-counter remedies or exercises without a proper understanding of the underlying condition or the client's specific needs. While seemingly helpful, this can still be considered providing medical advice without qualification and carries the risk of adverse effects or masking a more serious underlying issue that requires professional medical intervention. It blurs the line between general wellness advice and specific medical guidance. Professional reasoning. Professionals should adopt a decision-making process that prioritizes client safety and adheres strictly to regulatory boundaries. This involves active listening to understand the client's concerns, assessing the situation to determine if it falls within their professional scope, and when dealing with potential health issues like musculoskeletal disorders, clearly and promptly referring the client to a qualified medical professional for diagnosis and treatment. Documentation of the interaction and the referral is also a critical step in professional practice. Question 13. Examination of the data shows a patient presenting with intermittent abdominal pain, bloating, and a history of several unexplained weight fluctuations over the past year. The physical examination reveals mild tenderness in the upper abdomen, but no other significant findings. The patient denies any recent changes in diet or lifestyle. Which of the following represents the most appropriate next step in the medical decision-making process? Option A. Immediately refer the patient to a gastroenterologist for an endoscopic evaluation without further preliminary investigation. Option B. Order a comprehensive panel of blood tests, including inflammatory markers and liver function tests, and schedule a follow-up appointment to discuss results. Option C. Recommend a trial of over-the-counter antacids and advise the patient to monitor symptoms. Option D. Focus solely on the absence of acute findings on physical examination and reassure the patient that the symptoms are likely benign. The correct answer is C. Recommend a trial of over-the-counter antacids and advise the patient to monitor symptoms. Explanation. This scenario is professionally challenging because it requires the clinician to synthesize a complex patient history, interpret a range of examination findings, and then make a critical medical decision under pressure, all while adhering to established diagnostic and treatment protocols. The challenge lies in accurately weighing the significance of each piece of information, recognizing potential biases, and ensuring the decision-making process is both clinically sound and ethically defensible. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based method for medical decision-making. This involves a thorough review of the patient's history, a comprehensive physical examination, and the careful consideration of differential diagnoses. The subsequent decision is then informed by the integration of these elements, leading to a plan that is tailored to the individual patient's needs and aligns with current medical guidelines. This approach ensures patient safety, promotes effective treatment, and upholds professional standards by demonstrating due diligence and a commitment to patient well-being. An incorrect approach that relies solely on a single symptom or a superficial examination would be professionally unacceptable. This failure would constitute a breach of the duty of care, as it neglects the holistic assessment required for accurate diagnosis and treatment. Such an approach could lead to misdiagnosis, delayed or inappropriate treatment, and potentially adverse patient outcomes. Ethically, it violates the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Furthermore, it may contravene specific regulatory requirements for thorough patient assessment and documentation. Another incorrect approach might involve prematurely settling on a diagnosis based on initial impressions without considering alternative explanations or seeking further information. This demonstrates a lack of critical thinking and can lead to confirmation bias, where evidence supporting the initial hypothesis is favored while contradictory evidence is overlooked. This is professionally unsound as it bypasses the rigorous diagnostic process necessary to ensure the most accurate and effective care. The professional decision-making process for similar situations should involve a structured approach. 1. Information gathering. Systematically collect all relevant patient data, including history, symptoms, signs, and previous investigations. 2. Problem identification. Clearly define the patient's presenting problems based on the gathered information. 3. Differential diagnosis. Generate a list of possible diagnoses that could explain the patient's condition. 4. Diagnostic testing/further assessment. Determine what further investigations or examinations are necessary to differentiate between the possible diagnoses. 5. Synthesis and diagnosis. Integrate all findings to arrive at the most likely diagnosis. 6. Treatment planning. Develop a treatment plan based on the confirmed diagnosis, patient factors, and evidence-based guidelines. 7. Reevaluation. Continuously monitor the patient's response to treatment and be prepared to revise the diagnosis or plan as needed. Question 14. Performance analysis shows that coders frequently encounter documentation where a condition is described without explicit mention of the affected side. When a physician documents tendinitis of the elbow without specifying left or right, which of the following coding approaches best adheres to ICD coding principles and regulatory requirements for accurate diagnosis reporting? Option A. Select the ICD code for left elbow tendinitis, assuming it is the more common side affected. Option B. Select the ICD code for bilateral elbow tendinitis, as the condition could potentially affect both elbows. Option C. Select the ICD code for right elbow tendinitis, as this is often the dominant arm. Option D. Select the ICD code for unspecified elbow tendinitis. Correct answer is D. Select the ICD code for unspecified elbow tendinitis. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding where the documentation specifies a condition affecting a particular side of the body, but the coder must determine the most appropriate ICD code based on laterality. The professional challenge lies in accurately interpreting the physician's documentation and applying the correct ICD coding guidelines to reflect the patient's condition precisely. Misinterpreting laterality can lead to inaccurate billing, improper medical necessity determinations, and potentially flawed statistical reporting, impacting patient care and healthcare resource allocation. Careful judgment is required to ensure the chosen code aligns with the documented anatomical site. Correct approach analysis. The correct approach involves meticulously reviewing the physician's documentation for explicit mention of the affected side, left, right, or bilateral. If the documentation clearly states, for instance, right knee pain, the coder must select the ICD code that specifically denotes right knee. This adherence to laterality is mandated by ICD coding guidelines, which emphasize specificity to accurately capture the patient's diagnosis. Using a code that does not specify laterality when it is documented, or selecting the wrong side, would be a direct violation of coding principles and regulatory requirements for accurate reporting. This approach ensures that the coded diagnosis precisely mirrors the clinical information provided, supporting appropriate reimbursement and clinical data integrity. Incorrect approaches analysis. One incorrect approach is to assume laterality when it is not explicitly documented. For example, if the physician documents knee pain without specifying left or right, the coder should not arbitrarily choose a code for the left or right knee. This is a regulatory failure because ICD coding requires specificity, and making assumptions introduces inaccuracies. Another incorrect approach is to select a bilateral code when the documentation only specifies one side. This misrepresents the patient's condition and can lead to overbilling or incorrect statistical analysis. A further incorrect approach is to choose a code that specifies the wrong laterality, such as coding for the left knee when the documentation clearly indicates the right knee. This is a significant coding error with direct implications for patient care pathways and reimbursement. Professional reasoning. Professionals should adopt a systematic decision-making process. First, thoroughly read and understand the physician's documentation, paying close attention to anatomical references and any mention of laterality. Second, consult the ICD coding guidelines and index to identify all potential codes for the documented condition. Third, compare the available codes, prioritizing those that most accurately reflect the documented laterality. If laterality is not specified, use the appropriate unspecified code. If the documentation is ambiguous, query the physician for clarification before assigning a code. This methodical approach, grounded in accurate interpretation and adherence to coding rules, ensures professional integrity and compliance. Question 15. The performance metrics show a slight increase in the average complexity of diagnoses coded for a specific physician's patient encounters over the last quarter. Upon reviewing a sample of these encounters, you notice that in several instances, the physician has documented a condition as rule out or suspected, and the coder has assigned a definitive code for that condition. Which of the following approaches best reflects the appropriate coding practice in this scenario, adhering to ICD coding guidelines and regulations? Option A. Assign codes for all documented conditions, including those that are rule out or suspected, to ensure all potential health issues are captured for comprehensive reporting. Option B. Code the rule out or suspected condition as if it were definitive if the physician has indicated it is the primary focus of the visit, as this aligns with the physician's intent. Option C. Code only definitive diagnoses that are documented by the physician. For conditions that are rule out or suspected, do not assign a code unless the condition is confirmed and documented as such during the encounter. Option D. Assign codes for rule out or suspected conditions if they are likely to be the patient's primary diagnosis, as this reflects the physician's clinical suspicion. The correct answer is C. Code only definitive diagnoses that are documented by the physician. For conditions that are rule out or suspected, do not assign a code unless the condition is confirmed and documented as such during the encounter. Explanation. This scenario is professionally challenging because it requires a coder to balance the need for accurate and complete documentation with the potential for overcoding or misrepresenting the patient's condition, which can have significant financial and ethical implications. The coder must apply their understanding of ICD coding guidelines and regulations to ensure that the codes assigned reflect the patient's encounter accurately and compliantly. The correct approach represents best professional practice because it prioritizes adherence to official coding guidelines and regulatory requirements. This ensures that the patient's medical record is accurately represented, which is crucial for continuity of care, statistical reporting, and appropriate reimbursement. Specifically, it aligns with the principle of coding only what is documented and supported by the provider's notes, avoiding assumptions or interpretations that are not explicitly stated. This upholds the integrity of the coding process and prevents potential fraud or abuse. An incorrect approach that involves assigning codes based on assumptions or anticipated diagnoses without explicit provider documentation represents a significant regulatory and ethical failure. This can lead to upcoding, which is a form of fraud and misrepresents the severity of the patient's condition. It violates the fundamental principle of coding only documented conditions and can result in inaccurate data collection and improper billing. Another incorrect approach, such as assigning codes for conditions that are not the primary reason for the encounter and are not documented as being actively managed or treated during that encounter, also constitutes a regulatory failure. This can lead to inflated reimbursement and misrepresentation of healthcare utilization. It demonstrates a lack of understanding of the nuances of coding guidelines, particularly regarding principal diagnosis and secondary diagnoses. A further incorrect approach, such as omitting codes for conditions that are clearly documented and impact the patient's care or management during the encounter, is also a failure. This can lead to undercoding, which can affect reimbursement, data analysis, and the accurate reflection of the patient's overall health status. It suggests a lack of diligence in reviewing the entire medical record for all reportable conditions. The professional decision-making process for similar situations should involve a thorough review of the provider's documentation, a clear understanding of the ICD coding guidelines and relevant regulations, and a commitment to coding accurately and compliantly. When in doubt, coders should seek clarification from the provider or consult coding experts to ensure the correct application of guidelines. The focus should always be on reflecting the patient's condition and the services provided as accurately and ethically as possible. Question 16. Analysis of a financial advisor's interaction with a new client reveals that the client has expressed a general interest in growing their wealth, but has provided limited specific details about their financial goals, risk tolerance, or investment experience. The advisor is considering how to proceed, balancing the need for thorough client understanding with the efficient delivery of services. Which of the following approaches best reflects regulatory expectations for levels of service and documentation requirements in this scenario? Option A. Conduct a comprehensive risk assessment and needs analysis. Document these findings thoroughly and then propose a tailored service plan with clear explanations of the services to be provided and their relevance to the client's identified needs and risk profile. Option B. Immediately develop a highly complex, bespoke financial planning strategy, assuming the client desires the highest level of service, and document this strategy extensively without first confirming the client's specific requirements or understanding. Option C. Provide a standard, off-the-shelf investment product recommendation based on the client's stated general interest in wealth growth, with minimal documentation beyond a basic record of the product discussed. Option D. Offer a broad overview of various investment options without delving into specific client needs or risk assessment, and document this discussion as a general information session. The correct answer is A. Conduct a comprehensive risk assessment and needs analysis, document these findings thoroughly, and then propose a tailored service plan with clear explanations of the services to be provided and their relevance to the client's identified needs and risk profile. Explanation. This scenario presents a professional challenge because it requires a financial advisor to balance the client's desire for comprehensive advice with the regulatory obligation to provide services commensurate with the client's needs and the advisor's competence, all while ensuring adequate documentation. The core of the challenge lies in determining the appropriate level of service and the corresponding documentation without overservicing or underservicing, which could lead to regulatory breaches or client dissatisfaction. The correct approach represents best professional practice because it aligns with the principles of suitability and client best interests, as mandated by regulatory frameworks such as those governing financial advice. Providing a tailored service based on a thorough risk assessment and documenting this process comprehensively ensures that the advice given is appropriate for the client's circumstances, risk tolerance, and objectives. This detailed documentation serves as evidence of due diligence, compliance with regulatory requirements, and the advisor's commitment to acting in the client's best interest. It allows for clear communication of the services provided and the rationale behind them, fostering transparency and trust. An incorrect approach that involves providing a highly complex, bespoke financial plan without a clear indication of the client's need for such a sophisticated service and without commensurate documentation would be professionally unacceptable. This could lead to regulatory scrutiny for potentially overservicing, charging for services not required or understood by the client, and failing to adequately document the justification for the level of service. Another incorrect approach, providing only a basic, generic recommendation without a detailed risk assessment or sufficient documentation, would fail to meet the client's potential needs and could be seen as a breach of the duty of care and suitability, leaving the advisor vulnerable to regulatory action for inadequate advice and documentation. The professional decision-making process for similar situations should involve a structured risk assessment of the client's profile, including their financial situation, investment objectives, risk tolerance, and knowledge. This assessment should then inform the determination of the appropriate level of service. The advisor must then clearly define the scope of services to be provided, ensuring it is proportionate to the client's needs and the advisor's capabilities. Crucially, every step of this process, from the initial assessment to the final recommendations and the rationale behind the chosen service level, must be meticulously documented. This documentation should be sufficient to demonstrate compliance with all relevant regulations and ethical standards, and to provide a clear audit trail for the advice given. Question 17. Operational review demonstrates that a patient presents with intermittent chest discomfort, shortness of breath on exertion, and a history of hypertension. The attending physician is considering diagnostic pathways to investigate potential coronary artery disease. Which of the following approaches best aligns with current best practices for initial diagnostic evaluation in this scenario? Option A. Initiate a comprehensive non-invasive stress testing protocol, such as a stress echocardiogram or nuclear stress test, after a thorough clinical assessment. Option B. Recommend a cardiac MRI to assess overall cardiac structure and function. Option C. Proceed directly to coronary angiography to obtain definitive anatomical information. Option D. Prescribe a course of medication for presumed angina and reassess symptoms in 3 months. The correct answer is C. Proceed directly to coronary angiography to obtain definitive anatomical information. Explanation. Scenario analysis. This scenario presents a professional challenge in assessing the appropriateness of a diagnostic procedure for a patient with a complex cardiovascular presentation. The challenge lies in balancing the need for accurate diagnosis with patient safety, cost-effectiveness, and adherence to established clinical guidelines. Professionals must exercise careful judgment to select the most suitable diagnostic pathway, considering the patient's specific condition, potential risks, and the availability of less invasive alternatives. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a thorough clinical assessment and consideration of less invasive diagnostic options before proceeding to more complex or potentially risky intervention. This aligns with the principles of evidence-based medicine and patient-centered care, which advocate for the least burdensome, yet most effective diagnostic strategy. Adherence to established clinical pathways and guidelines, such as those often referenced in professional development materials like CPC exam prep, ensures that decisions are grounded in current medical knowledge and best practices, minimizing unnecessary procedures and associated risks. Incorrect approaches analysis. One incorrect approach involves immediately recommending an invasive diagnostic procedure without a comprehensive evaluation of the patient's symptoms or a trial of less invasive diagnostic methods. This fails to adhere to the principle of proportionality in medical interventions, potentially exposing the patient to unnecessary risks, complications, and costs. It also disregards the ethical obligation to minimize harm and explore all reasonable alternatives. Another incorrect approach is to rely solely on patient preference for a specific diagnostic test, even if it is not the most clinically indicated or appropriate. While patient autonomy is crucial, it must be balanced with the professional's responsibility to provide medically sound advice and ensure the patient understands the risks and benefits of all available options. This approach could lead to suboptimal diagnostic outcomes or unnecessary procedures. A further incorrect approach is to defer the diagnostic decision entirely to another specialist without contributing to the assessment or considering the patient's overall clinical picture. While collaboration is important, the initial clinician has a responsibility to perform a thorough initial assessment and propose a diagnostic plan, rather than abdicating this responsibility. This can lead to delays in diagnosis and fragmented care. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a detailed patient history and physical examination. This should be followed by a review of relevant diagnostic tests and consideration of established clinical guidelines. The potential benefits, risks, and alternatives of each diagnostic option should be carefully weighed, and the patient should be actively involved in the decision-making process through informed consent. This approach ensures that diagnostic decisions are evidence-based, patient-centered, and ethically sound. Question 18. Compliance review shows that a physician's progress note for a patient admitted with shortness of breath states, patient presents with dyspnea and is being treated for respiratory distress. The coder is unsure if the dyspnea is a symptom of a specific underlying respiratory condition, or if it is the primary diagnosis. Which of the following actions is the most appropriate for the medical coder to take in this situation? Option A. Assign a less specific code for unspecified respiratory symptoms. Option B. Assign a code for dyspnea as the principal diagnosis and a code for respiratory distress as a secondary diagnosis. Option C. Query the physician to clarify the underlying cause of the dyspnea and respiratory distress. Option D. Code the condition based on the coder's interpretation of the most likely underlying respiratory illness. The correct answer is C. Query the physician to clarify the underlying cause of the dyspnea and respiratory distress. Explanation. This scenario presents a common challenge in medical coding, where the documentation provided by the physician is ambiguous, leading to potential coding inaccuracies. The professional challenge lies in accurately translating the physician's intent into the correct ICD codes while adhering to coding guidelines and payer requirements. This requires careful interpretation of the clinical notes and an understanding of the nuances of ICD coding. The correct approach involves seeking clarification from the physician. This is best professional practice because ICD coding guidelines, such as those published by the Centers for Medicare and Medicaid Services, CMS, and the American Hospital Association, AHA, emphasize the importance of accurate and complete documentation. When documentation is unclear, coders are ethically and professionally obligated to query the physician to obtain the necessary specificity for accurate code assignment. This ensures that the patient's condition is correctly represented for billing, statistical, and quality reporting purposes, and it aligns with the principle of documentation drives coding. An incorrect approach would be to make an assumption about the physician's intent and assign a code based on that assumption. This is a regulatory and ethical failure because it can lead to inaccurate billing, potentially resulting in overpayment or underpayment, and can misrepresent the patient's condition in health records. It violates the principle of coding based on documented facts rather than inference. Another incorrect approach would be to assign a less specific code than is supported by the documentation, even if the documentation is ambiguous. This is a failure because it does not accurately reflect the patient's condition and can lead to underreporting of services or conditions, impacting healthcare data and potentially reimbursement. A third incorrect approach would be to delay coding indefinitely until the physician provides perfect documentation. While clarity is ideal, this approach is inefficient and can negatively impact revenue cycle management and patient care coordination. Professional decision-making in such situations requires a systematic process. First, thoroughly review the documentation to identify the ambiguity. Second, consult official coding guidelines for any relevant instructions. Third, if ambiguity persists, initiate a physician query following established protocols. And fourth, assign the code once sufficient clarification is obtained. Question 19. Research into the coding of a patient encounter reveals a physician's documentation listing several chronic conditions, including well-controlled hypertension, a history of appendectomy, and newly diagnosed diabetes. The physician's notes detail a discussion about the diabetes management, including medication adjustments and lifestyle recommendations, and also mention reviewing the patient's current hypertension medication. The appendectomy is noted as a past surgical history with no current impact on the encounter, which approach best reflects the accurate coding of the evaluation and management (E/M) service based on the provided documentation. Option A. Code based on the physician's documentation of active management of the diabetes and review of hypertension medication, while recognizing the appendectomy is historical. Option B. Code based on the highest complexity of any single condition documented, regardless of the physician's documented management. Option C. Code based on the number of chronic conditions listed in the problem summary, assuming all require management. Option D. Code based on the number of diagnoses mentioned, without verifying the physician's active management or the impact on medical decision-making. The correct answer is C. Code based on the number of chronic conditions listed in the problem summary, assuming all require management. Explanation. This scenario presents a professional challenge because the coder must accurately interpret the physician's documentation to assign the correct evaluation and management E/M code, which directly impacts reimbursement and patient record accuracy. The complexity arises from the nuanced nature of E/M documentation, particularly when it involves multiple comorbidities and the physician's thought process. Careful judgment is required to distinguish between documented conditions that are managed during the encounter and those that are incidental or historical. The correct approach involves a thorough review of the medical record, focusing on the physician's documentation of the history of present illness, review of systems, physical examination, medical decision-making (MDM), and the management of each identified problem. Specifically, the coder must assess whether each documented comorbidity significantly impacts the patient's current care, requiring additional work by the physician. This aligns with the ICD guidelines for E/M coding, which emphasize the medical necessity and complexity of the services provided. By accurately reflecting the physician's work in managing the patient's conditions, this approach ensures compliance with coding regulations and ethical billing practices. An incorrect approach would be to assign a higher E/M code solely based on the number of chronic conditions listed in the patient's problem list, without verifying that each condition was actively addressed or managed during the encounter. This fails to adhere to the MDM component of E/M coding, which requires the physician to document the number and complexity of problems addressed. This approach is ethically problematic as it could lead to overbilling. Another incorrect approach would be to ignore documented comorbidities that clearly influence the physician's decision-making process, leading to the assignment of a lower E/M code than warranted. This is a regulatory failure as it does not accurately reflect the services rendered and could result in underbilling, which, while less common, is still a misrepresentation of services. Further incorrect approach would be to code based on assumptions about the physician's intent rather than the explicit documentation. E/M coding relies on objective documentation, and making assumptions bypasses the established guidelines and can lead to inaccurate coding. This is both a regulatory and ethical failure. The professional decision-making process for similar situations should involve a systematic review of the E/M documentation components. Professionals should first identify all documented diagnoses and conditions. Then, they must critically evaluate the physician's documentation to determine if each condition was addressed, managed, or significantly impacted the MDM. This involves looking for specific actions, orders, or discussions related to each condition. If the documentation is unclear, the professional should query the physician for clarification rather than making assumptions or coding based on incomplete information. Adherence to the current E/M guidelines, particularly the MDM criteria, is paramount. Question 20. Stakeholder feedback indicates that some coders are struggling to assign the most specific ICD-10 codes for patients presenting with injuries and poisonings when the initial documentation is vague regarding the exact nature of the injury or the causative agent of poisoning. A patient record states fall resulting in contusion, and another states suspected poisoning, unknown substance. What is the most appropriate process optimization for these situations to ensure accurate ICD-10 coding? Option A. Query the physician for clarification to obtain more specific details about the type of injury or the causative agent of poisoning before assigning the ICD-10 codes. Option B. Assign the most general ICD-10 code available for contusion and suspected poisoning, unspecified to expedite the coding process. Option C. Utilize external resources or online forums to research potential causes or types of injuries and poisonings to supplement the limited documentation. Option D. Code the encounter based on common types of injuries or poisonings that occur in similar patient populations, even if not explicitly documented. The correct answer is A. Query the physician for clarification to obtain more specific details about the type of injury or the causative agent of poisoning before assigning the ICD-10 codes. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for accurate coding with the potential for incomplete or inaccurate information regarding an injury or poisoning. The professional must exercise careful judgment to ensure that the coding reflects the most precise diagnosis possible, adhering to established coding guidelines and the principles of ICD. The correct approach represents best professional practice because it prioritizes obtaining the most specific and accurate diagnostic information available. This aligns with the fundamental principles of medical coding, which aim to capture the complete clinical picture for accurate reporting, statistical analysis, and reimbursement. By querying the physician for clarification on the specific type of poisoning and the causative agent, the coder ensures that the ICD codes assigned are as precise as possible, reflecting the documented clinical encounter. This adherence to specificity is a cornerstone of compliant and effective coding. An incorrect approach that involves assigning a less specific code due to a lack of immediate clarity fails to meet the professional obligation to seek further information. This can lead to underreporting of specific conditions, inaccurate data collection, and potentially inappropriate reimbursement. Assigning a code for unspecified poisoning when more detail is available or could be obtained is a failure to apply the ICD guidelines diligently. Another incorrect approach, such as coding based on assumptions or external information not documented in the patient's record, represents a significant ethical and regulatory failure. Coders are bound by the documentation provided by the healthcare provider. Introducing external information or making assumptions constitutes a deviation from established coding standards and can lead to fraudulent or inaccurate reporting. This undermines the integrity of the medical record and the coding process. The professional decision-making process for similar situations should involve a systematic review of the documentation, identification of any ambiguities or missing information related to diagnosis, and a clear understanding of when and how to query the physician. Coders should be trained to recognize situations where specificity is lacking and to follow established protocols for seeking clarification. This ensures that the final coded data is accurate, compliant, and reflective of the patient's care.